Hey everybody, welcome to Techforpsych. I'm Dr. Cody Rall, your medical doctor confidant, coming to you from my new studio in Las Vegas here. In this video, we're going to talk to Dr. Jeff Tarrant, who has 20 years of experience in working with clients through neurofeedback meditation exercises. His most recent article talked about integrating neurofeedback meditation into the burgeoning field of psychedelic assisted therapy. We touched on several different topics to include the current state of medical treatment using psychedelics, the legal landscape, and what neurofeedback protocols could be helpful in preparation and integration of psychedelic experiences. We also touched on how we may be using brain-computer interface in the near future in a medical capacity in psychedelic treatment. Hope you enjoy. Dr. Jeff Tarrant, thanks so much for joining me from the Neuromeditation Institute. We've had talks before. I'm really looking forward to this one, so thanks for coming on.
Yeah, thanks for having me. It's good to be back.
There's been so much that's been going on in the field. You know, we were just talking, so a lot of new devices coming out, some new platforms online to use. And then most recently, I saw one of your articles that you wrote on and published on Psychology Today about integrating neurofeedback meditation into psychedelic assisted therapies, which is a huge buzzword these days. A lot of money pouring into psychedelic therapies. So I wanted to just ask you openly, you know, what is the state of psychedelic assisted therapy and how could we be using neuromeditation to help people get through those treatments and get the most benefit out of them?
Mm-hmm. Yeah, kind of a big question, right? And so, I mean, obviously in most places right now, psychedelics are still illegal. And, you know, so it's tricky, right? Because there's all this buzz, like you pointed out, right? Like there's all this interest, there's all this research being conducted, but it's not really available for use in the general, you know, sphere of professional work. Now, I live in Oregon, and we passed a bill last year legalizing psilocybin-assisted therapy. But that's not going to roll out for another year and a half or something. They're still figuring out the rules and regulations and how that's going to happen. So you see these trends of where this is going to be happening. Of course, you know, MAPS and their work with MDMA, you know, they're in phase 3 trials right now. So that's going to change things. So it's a little tricky because there's not as much availability to actually do this work, right? Like we're talking about it and we're seeing things in the lab, work that MAPS is doing in Johns Hopkins and other places, you know, but there are ways that we can start to kind of do this, right? So ketamine, for example, you know, so, you know, ketamine is being used. It's, you know, you can use it for treatment-resistant depression and other things. And it's not a traditional psychedelic, obviously, but seems to have some of the similar qualities in terms of using it in a therapeutic context. So that's one way that I'm kind of engaged right now. I'm not a physician. I can't prescribe ketamine, but I work with a doctor, a physician who does. And so he will refer patients to me to work with in the preparation and integration phase. So that's one way that we can start to do this work and figure some things out. You know, I also have done some work with there's a group in Colorado called Medicinal Mindfulness, and they've been doing this for almost 10 years of using cannabis as a psychedelic and using it really in the exact same context as psilocybin and MDMA and these other things. And so again, you know, in most states at this point, you know, cannabis is legal for recreational purposes. And so there's some ways that that can be used, right? So anyway, there's a few ways that I see people, and including myself, starting to do this work, even if we can't work with psilocybin yet or whatever. So there's kind of that element. And then, you know, I think what we're starting to figure out is, and again, largely from the research that's being conducted, is that the way people seem to get the most benefit from these therapies is if it is done sort of repeatedly, if the medicine is used repeatedly over a course of time and if there is support before, during, and after, kind of throughout that treatment episode. And so for me, that's really changing the way that I've been doing my work with this and thinking about it, is that it's not like, and I kind of said this in the article, right? These medicines aren't a magic bullet. They don't just magically fix everything. And I think that's the sort of a misunderstanding that a lot of people have, right? It's that you take 2.5 grams of mushrooms and somehow that fixes all your problems. And what we tend to see is that when people approach it that way, they feel amazing afterwards for a week or 2 weeks or 3 weeks. And then gradually things go back to the exact same patterns they had before. And so, really thinking about this differently, and of course, Robin Carhart Harris has written numerous brilliant articles around these topics, but really starting to understand that these moments, these time periods of using these psychedelics, it's really creating sort of an opening, a flexibility, a neural flexibility that is allowing the possibility of change. In fact, there's a brand new last couple of months, an article out, talking about these, pivotal mental states. I don't know if you've seen that article yet, but another one that Robin Carhart Harris is involved in. But, sort of creating these environments where the entire sort of neurobiological system has an opportunity to change lanes and do something different. But we have to support that. It's like just using the medicine by itself isn't probably enough to make that a permanent change. And so
the nomenclature kind of reflects that now too, because it's like psychedelic assisted therapy. It's not throw the psychedelic at someone and expect them to get the change. It's like we need, like you said, preparation, integration of what you learned during the experience to make those changes.
Totally. Yeah. And so that's where I'm getting pretty excited right now, is that, I didn't even see this initially, which, it took one of my colleagues, Heather Hargraves, who I think and I'm sure a bunch of people watching this know Heather. Heather knows everybody. But it really took her kind of, expressing some of her thoughts about this, that it finally clicked, that it was like, oh, I get it. And I see how neurofeedback can be a really important element in both the preparation and the integration phases of this work. From a preparation standpoint, there's a couple of things that really stand out for me. One is helping people learn how to recognize their own internal states and learn to begin to navigate that on their own. And really recognizing that that's a skill. And, people who have meditated for a long time, they sort of get that, right? They sort of understand that you can navigate your consciousness. But people who don't meditate, or maybe are having some significant mental health concerns, may really have no skill in that whatsoever. In fact, they may avoid going inside. And so thinking of that, if you've got somebody they've got treatment-resistant depression, they're going to use psilocybin, but they've got no background or skill in looking inward. And then you're going to throw them in a situation where it's super intense, this, inner sort of exploration. It's like that may actually be a setup for causing more difficulty for the person. They may not be ready for that. And so, using neurofeedback, because really a lot of neurofeedback, and especially when combined with meditation, it's about state awareness, being aware of your internal state and learning how to work with it intelligently. So I feel like that's one, big area where this can be super helpful.
And I wanted to plug your book here, Meditation Interventions to Rewire the Brain. Because I've had you on before and we went over sort of the 4 meditation styles that you talked about in this book. And, reading your article kind of revamped my mind of like, well, I wonder how Dr. Tarrant is applying those 4 meditation styles to psychedelic assisted therapy. So I'd love to hear your thoughts on where those styles fit into this whole preparation and integration work.
Yeah, that's an interesting question. And so the way I've been kind of doing that, I mean, again, this is all still pretty new, right? Like this idea, and actually my work in this area is still relatively new as far as using it with sort of psychedelic, work. But typically what I'm doing at this point is kind of doing some sort of an assessment with the individual, trying to understand where their stuck spots are, both psychologically, but then also looking at their brainwave patterns and seeing, well, what are the patterns that emerge in your baseline EEG signature, and how do those connect to your concerns? So whether it's depression or anxiety, can we see sort of a neural signature that fits with those concerns? And so then based on whatever that is, let's just make something up for, discussion purposes. So if somebody's got anxiety, and let's imagine that I saw a lot of fast brainwave activity, that'd be sort of a stereotypical thing that you might see. So I know that certain styles of meditation are going to be more helpful than others at quieting down that fast brainwave activity. So quiet mind practices, mindfulness, are going to sort of do a better job at quieting that down. So for me, I'm kind of using it that way, right? Is looking and going like, where's your brain the most stuck? And how can I help facilitate through meditation and neuromeditation, creating a little bit of flexibility in that stuck pattern before you're just kind of launched in. So, kind of using that kind of idea of like, where are they stuck? And then how can we counterbalance that? So that's kind of the primary way that I'm using the neuromeditation with people at the beginning. The other thing that where neuromeditation I think becomes important, and it's a similar concept, but it's a little bit different, is there's been some research showing, looking at who are the people that benefit the most from these psychedelic therapies, and looking at personality traits or personality styles. And there's some pretty clear patterns that are emerging, and they're pretty obvious if you sort of think about them. So people that are more open, more accepting, able to be, sort of let go of their internal experience and not try to over control things, they do better with psychedelics, and they have a better therapeutic outcome. People who are confused, who are not open, who, maybe more sort of neurotic, don't do as well. And again, we've kind of known this out there in the world in general, that, people who sort of fight the experience, it's likely to be more unpleasant. Sort of resisting is not really what you want. And so again, like, we can take that idea, that understanding, and again, think about neuromeditation and like, well, how can we encourage those states of openness and letting go, with neuromeditation, so that we're kind of priming the system to be more open to a psychedelic experience and hopefully have a better outcome. And the reality is that to some degree, all of them provide that. And I'm sure you found this, Cody, with, your work with using different devices. One of the things that stands out for me using EEG devices with meditation is that trying too hard is the easiest way to screw it up. And it doesn't seem to matter which meditation style you're doing. If you push, if you overexert your attention, it throws it off. And so for me, that's an amazing lesson, right? That it's like, when you put that headset on and it's so sensitive to efforting, to trying, So it gets back to that idea, right? That it's a felt state that you're looking for. It's not a technique, it's not a whatever, it's a felt state. And the only way to get into that felt state is to be in that state, not doing a bunch of stuff, not forcing it. You just have to exist in this felt state, which is really tricky. It's like, how do you learn to do that? And I feel like that's where the EEG technology is amazingly helpful, because for me anyway, I feel like it points out even the slightest over effort. And so I have to keep learning how to like relax into it, relax into it, relax into it, relax into it, allow myself to be in this space without pushing. And so in that way, actually, just about any of the protocols can work, right? To sort of help facilitate that. The other one that I'll bring up that, and this is one, it only gets a short mention in the book because when I wrote the book, we weren't doing this. Again, this is an area where Heather and I have collaborated, but protocol that we kind of call deep states, and for lack of a better term, and really it's based off of psychedelic EEG work and sort of understanding, well, what does the EEG signature look like with psychedelics? And it's fairly consistent. And so can we get the brain to do that without psychedelics? And you can. It usually doesn't lead to a psychedelic state, although sometimes it does. Usually it doesn't. But again, it's like teaching the brain how to be comfortable in these unusual states of consciousness. And by unusual, I mean, not your normal, waking, everyday kind of consciousness, like learning to be somewhere else that's going to feel a little bit awkward and to be okay with that. And what's interesting, if you look at somebody's brainwave patterns when we're doing the neurofeedback with the deep states, because really what we're doing is decreasing everything, especially in the default mode network. And, so everything's going down. And for me, what's really interesting is if you watch people's patterns, very consistently, what happens is everything goes down, goes down, goes down for 15, 20 minutes or something like that. And then almost like clockwork, there's a giant increase of some of those brain waves, somewhere 15, 20 minute mark, whatever. And initially I didn't understand what that was. And over time, I came to kind of really understand that what seems to be happening is that that's the point at which the ego has had enough of not being in control and reexerts itself. And so, it's interesting because you're really learning, like, can you get your ego out of the way and just kind of like move into this state that's a little bit more fluid, a little bit more open, a little looser. And, and you can learn how to do that. So anyway, I think there's a few different ways that we can use kind of neuromeditation in these different styles, to really, help someone get a little bit better prepared for these big experiences.
Yeah, it's amazing. And in the mental health field, it feels like we've kind of, over the last 20, 30 years, kind of come up against a point where, we've made as much progress, it feels like, as we can, of using, sedatives like benzodiazepines or, the serotonin reuptake inhibitor medications, which help replenish some serotonin deficient states that help people calm down from anxiety and maybe move forward with their lives. But as we get into these more powerful medications that, as you said, create these flexible mind states, it's like, they're powerful. And it's almost like doing surgery with people. So we need to prepare adequately to do that. And you've been in the field for so long, so I love hearing you talk about this. It's like, how have you seen the field progress, and where do you see it going in the next 5 to 10 years in terms of actually using brain data to assess the mental state of someone so they can get the best treatments and move forward? I'm really curious to hear your perspective on that right now.
Yeah, I mean, that's an interesting, I'm laughing a little bit because that's an area that I probably should know a lot more about. But I think what we're going to see is, in the next few years, and people are already starting to do this, but it's not sort of widely out there, but, using, AI and machine learning to be able to predict, responses to things so that you can get really accurate. And we're already doing that. I mean, there's companies out there who are doing this with treatment-resistant depression with medications. They can look at your brainwave pattern and pretty accurately figure out what medication you're going to respond to. And usually it's not one of the typical antidepressants. Usually it's something else, right? And so it's like, how did they figure that out? I don't know. Machine learning, right? Let the machines figure it out.
Yeah.
But I think we're moving in that direction more and more, right? And I think we're going to see that even with the psychedelics, using EEG and other parameters to figure out what's the right dose for the right person to get the best effect. In fact, I was just thinking about this with cannabis. I mean, again, most people don't think of cannabis as a psychedelic, but it can certainly be used that way. It can absolutely be used that way. And, we did a little pilot study, with 9 subjects, on 3 different, each subject came in 3 different times, and smoked a different strain of cannabis, and we recorded their brain waves and all this stuff. Anyway, we've been messing with this data for 2 years. There's so much data. But one of the things we found is a dose response curve, that the brain waves look a certain way when there's a light dose, and then the brain waves completely shift when there's a higher dose. So, when they take a few hits, brain waves look like one thing. And then when they've taken 6 or 8 hits, the brain waves look totally different in the same subject. And so, again, I think we're going to be able to use that kind of information in the future to, be able to figure out how can I get the effect that I want, for this particular individual. Same thing with microdosing. There's a lot of interest in microdosing, LSD and psilocybin. And again, the data looks really impressive at this point. Again, for things like depression. And, how do you know how much you should take or how frequently you should take it? I think we're going to be able to figure that out with, some of this technology. And maybe even get to the point where we have, predictive models where we can look at somebody's baseline EEG and go, oh, you got that kind of brain. Okay. There's your phenotype. Here's what's probably going to work best for you. Which is pretty cool. I mean, I think that's awesome. More personalized,
it's amazing.
Right?
And it's like we're getting this convergence of psychedelics are getting more research and being legalized to be used within controlled settings for mental health treatment. We've got much more powerful computing power and software using machine learning and different analytic tools to understand these complex brain signals that are coming out. And then it's almost like the third thing that's happening right now is we have hardware and devices that people can use in their homes where you don't have to go into a brick and mortar clinic. It doesn't cost the physician, $100,000 to get the equipment to use. And that's where I'd like to parlay into talking about an effort that you've been involved in the last year or two called Divergence. You guys are announcing pretty soon a new system to be used. I'd love to hear as much as you can tell us about what's coming up for Divergence and also what Divergence is.
Yeah, that's probably a good place to start. Divergence is a software company. And so their whole idea is to, it's an EEG based software platform. And the idea is for it to be sort of hardware agnostic, that it could work with a variety of different EEG recording systems. So initially it's going to be working, or it is working with the Neurosity Crown, which is an 8-channel Bluetooth wireless device. And, the Divergence platform is, does a few different things, but one of the things that it allows is for neurofeedback practitioners to basically create any kind of protocol you would want based on the device you're using, and then push that out to your clients. So they literally would download an app on their phone and open it up, and they would have the app that, or the protocol that you just created for them. They put the thing on their head at home, they run the session, do the thing, and then the clinician has access to that data live. Like literally, I could pull it up on my computer, watch it as it's happening. I could even make adjustments to the protocol live and then push them back down to the client at home. So, this really changes the way that a lot of, some of this work is going to happen, right? Because it's going to make sort of remote training really flexible and really powerful. It's also got assessment tools built in. So again, theoretically, I could create an assessment that's either a standard assessment, like maybe the GAD-7 or something like that, right? Like something to assess anxiety. I could push that out to the client, say, I want you to take the GAD-7, then I want you to do this neurofeedback protocol, then I want you to do this little one item, how are you feeling, subjective scale. And so literally I push it to their phone, it goes in order, or they take the scale, the results go straight to me. So, it's this kind of relational technology is really what they're trying to accomplish here. The other element of the platform that's really, for me, very exciting is that we're going to be putting all the neuro meditation protocols in there so that even if you're not a neurofeedback practitioner, you could access the protocols. And, they're, we're still sort of finessing some of that. But so you could be able to use the focus or quiet mind or mindfulness or deep states even protocols, just kind of right out of the gate. So, and then of course, down the road, there's additional plans for incorporating things like cognitive testing and things like that. So it's really kind of going to expand to a pretty well-rounded platform that would allow a lot of different things, including data collection. So kind of back to our point we were just making, right? That you could just put the thing on and just do a recording and then have this data that you could then, drop into some other system or do whatever and analyze it. And again, the hope is that down the road, maybe there's a AI algorithm where you put the thing on your head, you run it for 3 minutes, and it knows something, right? It knows whatever it is that we're trying to do, and can make some recommendations. Maybe there'll even be a point where it would do that for the meditation styles. Right? You put the thing on, and it's able to sort of like make a prediction about which meditation style might be best for your particular brain pattern, based on what your goals are. Like, be super cool.
Yeah, and I'm really excited to see it. I can't wait to interview some other members of the Divergence team and, show the YouTube audience here on Techforpsych, examples of how this platform can be used. But, I wanted to thank you for everything that you do, until we get computers being able to just read your brainwaves and spit back the results to people. We're definitely going to need experts such as yourself with all your experience in the neuromeditation field to help teach the computers first what to look for. So thanks so much for coming on. I really enjoyed the conversation.
Yeah, thank you, Cody. It's always nice to catch up with you, and I appreciate all your work. So thanks for everything you're doing.
Thanks, Jeb.
All right, man.